All right, good morning, everybody. I am really appreciative of everyone who's here right now. We lost quite a few people today to night out and the tables, et cetera. So thank you for all the loyal people here today. We appreciate that as the speakers, not looking at an empty crowd. Excited to talk to you about the work that we've been doing at Stanford Health Care with Tableau. My name is Joshua Frost. I'm the manager of the Patient Experience Analytics and Reporting team. And I'm here with my colleague, Evan.
Hi, everyone. My name is Evan Mo. I am the Senior Data Scientist at Stanford Health Care.
And we're really excited to talk about the work that we've done over the last year. Really wanted to start with a quick question that probably you've answered many times so far. Who's here for the first time at conference? Wow, actually quite a few people. And how many people are relatively new to Tableau within the last year or so? That's really awesome. So a year ago, we were in your position. So we went to conference in New Orleans, but we were only 5 days removed from getting access to Tableau Desktop. And so really hadn't used it, hadn't worked with it at all. But we saw all of the exciting work that was being done, not only in the healthcare space, but in the other industries. And we promised ourselves that we would be back here, and the next time that we were here at conference, we'd be on stage. So really excited to show the work that we've done. In terms of the agenda for this session, I'm going to talk a little bit about who we are and just what Stanford Health Care does in the Bay Area, talking about patient experience reporting and the need for change in terms of our historical reporting. Then we want to get into a case study where we talk a little bit about how we implemented Tableau with our partners in the primary care service line and some of the challenges that came with reporting patient experience data. Then we'll tell you a little bit about where we are in our journey and our next steps, and lastly, we'll open it up for questions. So some of you may have heard of a tiny university in Palo Alto, California, called Stanford, and they have a couple of beautiful palm trees. Some companies have been started there. You might have a couple apps on your phone. We're the academic medical center that's actually connected to that university. So not only do we train the providers of the future, but we actually do have a role to provide health to our community. And we're no slouches ourselves. We're actually the only level 1 trauma center between San Francisco and San Jose. So we actually do have quite a few complex patients that come to our system. In terms of honors, we've been recognized as a U.S. News and World Report Top 10 hospital in previous year. We also have been recognized as a magnet hospital for nursing excellence for the last 3 consecutive periods. And getting a little bit into our domain, we have a history of excellence with our providers. 98.4% of our physicians are actually rated 4.5 stars or higher based on patient feedback. So really, really good performance from our providers. And Stanford Health Care's mission is really to heal humanity through science and compassion, one patient at a time. And obviously, one of the key elements, especially when it comes to the compassion, is the patient experience. So patient experience has always been a huge priority for Stanford Health Care. But in recent years, with many more resources coming out for our patients to learn about their providers, learn about the health systems that they interact with, healthcare has really become more of an elastic commodity. And so we know that our patients have choice. And we know that there are many different things that impact the patient's experience, whether it be the actual interactions that they have with staff and providers, whether it be the physical environment, if they have construction issues on the way in, if they have parking issues, all these things impact the patient experience. And especially in Silicon Valley, the technology that we use and how we interact with them outside of the interactions in the moment all impact the patient experience. And so that's really where our team comes in. We partner with managers, frontline staff, physicians to help them translate the feedback that we're getting from our patients and understand what they're getting so that they can make improvements on the day-to-day interactions that they have. So how we do this is we actually partner with a third-party vendor, Press Ganey, to survey our patients a few days after their encounter. And just some information about the surveys themselves, in case you didn't know. We actually have different surveys for all of the different care environments that our patients visit us in. So an inpatient survey looks different from an emergency department survey. But there are some commonalities. And the commonalities are that we have quantitative and qualitative data on all of our surveys. And the quantitative really come from the questions that we ask, which are rated by our patients from very poor to very good on a 5-point scale. And then each section of questions has space for patients to leave comments about the questions that they were just asked. And so what we do is we work with that data and translate that into reports that our organization can then use to make improvements. Now, some of the key questions that one of the key questions that spans across all survey instruments is the likelihood to recommend question. Now, for those of you who work in healthcare, you may know that likelihood to recommend is used as our net promoter score or our key outcome metric for patient experience. In particular to the case study that we'll be talking about today, we also have a likelihood to recommend care provider question so that we can help keep our physicians accountable as well. And so we have that in the ambulatory care setting. So whenever you come into a primary care location, you would receive both of those questions. And the actual metric that we use when we report to our organization is a top box score. This means we're looking at the percentage of patients that rated us very good on any question. So just a quick example here, if one patient rated us very good, one patient rated us fair, then we would count that as 50% of a top box. So in order to keep measuring all this, we obviously have to do quite a bit of reporting since we have such a large system and we want to make sure that everybody gets their data. Now, this may sound like a little bit of a non sequitur, but do we have any superhero fans in here? Superhero fans? Yeah? Marvel, DC, comics, etc. So kind of connecting it, I want to see if this scenario sounds a little bit familiar to you. So you're coming in on Monday morning. You know it's a heavy production week for your team. So you know that this means you're going to be stuck in shared drives, pulling Excel files, working with formulas, trying to get all of your normal reports out on time. But you come in and you notice you have 5 urgent emails from some of your key stakeholders that are requesting some additional data or looking to dive deeper into their data. So in this scenario, what do? And the right answer, the first answer is going to be reprioritization, but I don't know if anybody else here has problems with reprioritization or has to get things all done at the same time. But we're kind of expected to make sure that we get them out. So what do we do instead? If you're anything like us, then maybe what you do is you hunker down, you put on your headphones, and you put on the cape, and you start doing your best superhero impression. And so that's what my team is. We are a team of superheroes. And we actually denote all of our work and projects with our superhero logos, just to symbolize the work that we do and the fact that we're not having to put in Herculean efforts every time, but that we want to make sure that we do everything that we can to best provide the information that we can to our patients. So what is it that we actually report on? So I want to talk a little bit about the current state of our reporting prior to Tableau. So most of our reports were actually in Excel. We did a lot of trend charts, a lot of tables, which are useful for showing performance, but really didn't have a lot of insights. And the other way that we really had to do reporting is partnering with our IT teams, who were on a different visualization program and did have server access, but then we had to go through the issue of prioritization. And could we get on the schedule to create a solution for our organization? Now, I think patient experience is one of the most important things, but I also understand that our IT colleagues have to work with clinical quality and actual things that impact the patient the moment of. So we knew that we needed to take things into our own hands so that we could provide more insights to our stakeholders. We could start connecting to a data warehouse and really get our work automated in a way that would be helpful to our organization. So we were looking for a program or a tool that would help us automate our processes, create some predictive analytics, create dynamic and easy-to-use visualizations for our users, and really create insightful visualizations. So we decided in October of 2018 to purchase Tableau Desktop. I know, we probably should be on Tableau Server, but we are working on that right now. And I'm actually pretty happy to say that we're making good progress in that. But initially, we knew that we could use Tableau Desktop to create some visualization that would gain some buy-in. So to be frank, we had no experience with Tableau Desktop at the time, or Tableau at all. As I said, we were really stuck in Excel world. So I knew we needed a couple of things. We probably needed some training, and so we partnered with Tableau to come and do in-house workshops with us for 3 days, where we got both the basic and intermediate trainings and are highly recommended in case you haven't done that. And then we also needed some experience. And so that's where we went out and recruited Evan, who had previously used Tableau for about 4 years with his experience at UCLA Health and DaVita Health. So now that we had some experience and we had some training, the real question is, where do we start? And so we were looking across our system for a place where we could get a big win at the beginning of using Tableau. And what we knew we wanted was physician leadership that would encourage the usage of a new tool that wasn't an Excel, PDF, or any other report that they had previously received. We also wanted to work with a team that had maybe some lower or middling patient experience scores so that we can show some key improvement. And then lastly, we really wanted to think about where is it that we can impact patient loyalty? Because we want to make sure that our patients are thinking about Stanford Health Care and considering that when they recommend that to their colleagues. And so with that, we decided to partner with our primary care service line. Our primary care service line is actually pretty small. Even today, we only have about 22,000 visits in primary care per year, compared to our specialty care, which sees about 1.5 million visits per year. So very different scope, and we're really trying to grow that within the Bay Area market. One of the things that we had noticed over the previous few years is that their performance had really stagnated. So it had been 3 years since we've seen any really significant improvement in their scores. And even in more recent years, we had seen a slight decline in their physician satisfaction scores as well. So we knew that this was a good place for us to start, especially since our physicians in the primary care setting had been highly engaged with us in terms of the requests that they wanted to add on to their reporting. So now that we had a partner, I asked Evan to look at a few years worth of data and think about what is a design that would help this service line improve their scores. So with that, I'll hand it over to Evan.
Thank you so much, Josh, for the introduction and introducing Stanford Health Care and our leadership, our relationship with primary care leadership. So today, I am very thrilled to show you what we have been working on by using patient experience data in Tableau. So by show of your hands, who in the audience work with other stakeholders and create dashboard for them? Wow, most of you. That's great. So think about this scenario. So on Friday evening, you finally put everything together in one beautiful dashboard. You have bubble charts, you have scatter plots, everything in one place. You worked so hard to create some calculations, and now, finally, you're so ready. You're so excited for Monday morning meeting. So you present that dashboard to your leadership, and you're very excited, so you're saying, here is the new dashboard. Aren't you guys happy? And it seems like that they're not sharing the similar sentiment, and you're thinking, well, what's happening? What's wrong? So it seems like they're not liking the dashboard. And why? Because they don't know where to use it. They don't know how to use it. They say, well, this is really cool. It's really beautiful, but I don't know where to use it. Or even worse, they say, well, okay, we will use it, but they never end up using it. Then, what do? You don't have to raise your hand, but I'm assuming most of you have went through this kind of scenario. So we are trying to design with end users in mind. So before we presented our dashboard, we thought of some of the ways we thought of some of the ways that they would like. So phase one dashboard is before we presented our dashboard to our stakeholders. We thought that primary care leadership would like to see qualitative data, so comments, for example, quantitative data, so LTR scores, percentile data are some of the examples we thought they would like. We also thought executive level dashboard should provide high-level overview. So if they can understand everything within 30 seconds, that's good. And we also thought manager, director level dashboard should provide actionable insights. And when we say actionable, we really mean actionable. So we have two different phases. Phase one, as I mentioned, is before we showed our report to our stakeholders. Phase two is after we made all the changes. And we want to just show you how we made some of the changes. So with that all said, I am very pleased to show you phase one dashboards. And before I start, I must tell you that all the data here is all fake data. And we are HIPAA compliant, so any of the comments here are all made up. So here is phase one data for tier 4 and 5, that is for administrative directors and vice presidents. So on the right side here, you can filter down to different sites. So we have multiple primary care locations, A to J. You can filter down to different visit dates. If any of the executives or vice presidents have questions on the terms that we use, LTR, top box, those can be confusing sometimes. So if you hover over here on the right side, you can find all the information that you need. So on the top, you see the LTR top box score from September to May. So here we have N size and percentage. The red line here is the target, which is 84.8%. So here you are seeing the general graph here. On the left and right, you are seeing some of the background information. So here you see number of surveys, e-survey ratio, LTR top box score, and this is making neutral phase because it is almost hitting the target, but not yet. If it goes below 1% of our target, it will make sad phase. If it goes above 1%, which is 85.8%, it will make happy face. On the gender ratio, we have females 59%. And on the center here, this is scatter plot. On the x-axis, there is LTR top box difference, fiscal year 2018 versus 2019. So all the dots on the right side, those are the clinics that they're doing better this fiscal year compared to last fiscal year. On the y-axis, there is average top box score, and this red line is target percentage. So all the dots here above the target, that represents some of the clinics that are doing better than the target. So on the upper section here, this square, we would call that some of the clinics that they're doing better this year, and they're above the target. So these are good clinics, positive drivers. And these are opportunity drivers. So clinic F is doing worse this year, and they're not hitting the target. And below here, there is what if capability. So oftentimes we get the question that what happens if clinic F and G do better this year? What would happen to the overall score? And this is happening in the back end. This calculation is happening in the back end. So if we change clinic F to, instead of having stays at its current LTR, what happens if we change it to reaches its target? So I'm going to change F to reaches its target, G to reaches its target. Now it is doing better than the target, which is 84.8%. So this is one of the examples how leaders can ask the questions and take actions. On the second dashboard, here is dashboard for tier 2 and 3, that is for managers and directors to take operational usage. So here we see the same graph that you have seen in Tier 4 and 5 dashboard. On the right side here, there is fiscal year to date percentile information. And these are all the questions that Press-Ganey asks. So on the top, there is likelihood of recommending practice. It is saying it is 61th percentile. Below, there is likelihood of recommending care provider. And you may wonder, what is this color? What does this color mean? And we sorted all the questions by correlation to likelihood of recommending practice to others question. So the idea is that if we can increase the score of likelihood of recommending care provider question score, then there is a higher chance of increasing the score for likelihood of recommending practice. Well, that does not mean that ease of getting clinic on the phone is not important, but we at least give the give the idea of what are some of the priority questions to focus on. On the left, there is LTR, practice to others, non-top box frequency. So if people are not giving very good score, what other scores are they giving? So for example, here, there is very poor section. For site F, the percentage is 4%, and compared to other clinics, that is higher. So you may ask the question, okay, we may ask the question why this is happening, and the leaders can investigate further. On the right side, there is another scatter plot. On the x-axis, there is total N size. On the y-axis, there is top box score. So H, clinic H here, has survey volume of 686, and that is the reason that is on the right side. Clinic B is above here because the survey volume is 93, but the top box score is 91%, which is 6.6% above our overall target. And you can also filter this to different questions. So for example, we knew that we want to improve on scores on, let's say, cleanliness of our practice. Then we can just click on it, and all the graphs would change. And this one is our phase 1 comment search dashboard. And you can simply type some of the keywords that you want to search on. So for example, you can type explain, because we knew that doctor's explanation was something that we wanted to improve on. So you can search on explain, and we see how frequently that word appears in our surveys. On the right side, there is sentiment distribution. So 66% were positive, 33% were negative. And you can read some of the sample comments there as well. So when we showed this dashboard, people were very happy. They were very, very excited to implement Tableau. And also, there were some of the constructive feedbacks as well. First, they requested for a control chart to validate performance for physicians. Second, they requested for a trend line to provide a business context. Third, they requested for more insights on comments with the ability to filter in physician level. Fourth, they thought gender internet survey information is currently not actionable. Last, what if functionality is only great for one-time analysis? So, by show of your hands, who in the audience has worked with patient experience data before? Oh, wow, I see many people. Okay, great. So next question is, who in the audience has worked with control charts before? Wow, okay, many hands going up. So, giving you the brief summary of what SPC Chart is. So SPC Chart is industry standard methodology for measuring and controlling quality during the business process. And different types of quality control charts such as X bar, S chart, NP chart, U chart, U prime chart. Well, those charts need to be used based on what kind of data that you are analyzing. So on the left side here, you see typical control chart. It has 3 sigma level, upper limit, lower limit, Everything in between is called in control. Anything that goes outside is called outliers. But on the right side, we have our standard top box metrics. So what is the best metric to add on our graph? So for requests for a control chart to validate performance for physicians, they ask this question: how good is good? How bad is bad? If we are below the target, does that mean we are always bad? Let's assume that the target is 75% and we are hitting 74%. Is that same as 60%? How good is good? Is 95% good enough? And we also had to come up with a method that works for both statistical and non-statistical group. Just because one person asked us to put statistical method in the trend line does not necessarily mean we need to all of a sudden put 6 different lines on control limits and give them z-score, any other statistical formulas there. So the way we found out the solution is P-prime chart. So P-chart is statistical control for attribute data. So it's for percentages. If you see any percentages, you're using P-chart. It works better when subgroup sizes are somewhat consistent. I had to use the term somewhat, but I will explain what that means. Laney's P-prime chart, and we call that P-prime chart. For this one, subgroup sizes can vary. This reduces false alarms due to over-dispersion and under-dispersion. So on the left side, that is P-prime chart example. So you see control limits going up and down depending on the subgroup size. And on the right side, it may be a little bit tough to see. But on May 2019, it is at 90.6%, N size is 85. And all other months, you are seeing about N size closer to 80 to 100. And here, on August 2019, notice that May 2019 is having green dot here, and August 2019 is not having a green dot, even if this 91.7% is higher than 90.6%. It is because N size is 24. It understands that the N size typically goes from 75 to 100. So finding statistically significant insight using P-prime chart. We would like to call large shift when we see monthly averages are above or below 1.5 standard deviation. I know this is different than typical 3 sigma, but we are using this. 2 out of 3 months is above or below one standard deviation. That is when we also call large shift. Small shift is when we see 6 consecutive months above or below average. Strong trend is when we see 5 consecutive months trending upward or downward. So what kind of changes have we made from the feedback? So for the request for control chart to validate performance for physicians, we added P-prime chart with z-score. For the request for trend line to provide business context, we added regression line. For the request for more insights on comments with the ability to filter in physician level, we added filters as they requested, and we thought we could do more than that. So we connected with LTR scores and LTR care provider scores there as well. As they requested, we removed gender internet survey information and what if functionality. And with all that, I am very, very pleased to show you phase 2 dashboards. So here is our phase 2 dashboard after implementing all the changes that our primary care leadership had asked. Immediately, you see everything very colorful. Everything got very, very big. On the top, there is our LTR score top box graph. On the left, you see red, On the right, you will see green. And you will see that there is a regression line here. So you may be wondering, why is this showing red? Why is there arrow heading down? And you can hover over. It is because 2 out of 3 months are below 1 standard deviation. So for August 2018 and June 2018, those two are the months below 1 standard deviation. So z-score here, for the people who would be interested in looking into more of the statistical insights, the z-score is here, -2, and this dot is showing below 1.5 standard deviation, so it is in red. So on the right side here, this is showing green because 6 consecutive months are above average. On the right side here, now it is making sad face. But everything here, it got bigger. On the left side, previously we had a scatter plot with 4 different sections, but now we decided to give them a name. So here we have positive drivers for the clinics that they're doing better this year and are doing better than the overall target. Here is supporters, challengers, opportunity drivers. Opportunity drivers are the clinics that they're doing worse this year compared to last fiscal year and not hitting the target. So I want to know more about Department F. So what is happening in that department? So I'm gonna click on Site F just to understand what is happening using statistics. So here, starting from August, seems like 6 consecutive months are above average. And here, December 2018, it is hitting its peak, so 90.2%, which is above 1.5 standard deviation. Z-score is 1.9. And it's going down, down, down. So 5 consecutive months are trending downward. Here again, this month is July 2019. For this month, below 1.5 standard deviation. Going over to manager and director level view, this is pretty much same. It's all same, but we got rid of the scatter plot, and we expanded the percentile information. And comment dashboard is something that I'm very, very excited about. So I will explain here. On the left side, there is LTR care provider scores. Down here, there's LTR, likelihood of recommending hospital to others question. On the right side here, there is sentiment distribution by different sections. So you can read some of the sections here: access to care, human caring, care provider, nurses, or about visits. Below here, all the comments are listed, sorted by dates. So I will give you a quick demo of how leaders can use this. So assume that I am Department F director, and I want to improve on my department's LTR score. So I'm gonna filter this department to F. And I can click on score 1 because I want to know, I want to read the comments for the people who give us very low scores. So here, I can read some of the comments here. So for access to care section on July 2019, this patient mentioned had to wait for a long time to schedule for my physician. Reading overall, did not have good experience. The registration area was somewhat messy. The physician was not friendly. So those are some of the examples how department leaders can just read through some of the comments and take actions. So going back to default setting, and assume that this time I am a physician who wants to improve on my LTR care provider question score. So I'm gonna click on provider 19. And I'm going to filter this to only care provider comments. I'm going to click on LTRCP1. So here, patient is saying, the physician can definitely improve on bedside manner. The physician seemed a bit rushed, barely any eye contact. So this is one of the examples how physician can read what patients are saying and improve on his or her eye contact or their bedside manner. One more example. So we know that doctor's explanation was not one of the areas that we were doing well. So I'm just gonna go back to our default setting for all comments. And I can search for explain. And here now, I can read. So this patient in April 2019 said, I love Dr. 19. The doctor explained everything in a way that I could understand. And this person gave very good for LTR care provider questions and LTR score. So those are some of the use cases that we can use this dashboard to take actions. So you may ask the question, how did we put P prime chart in Tableau? Okay, so that's a long story, but the code is actually 11 pages long, but this is the sample. So we are trying to look at different scenarios of when 2 out of 3 methods are below 1 standard deviation, below 1.5 standard deviation happen, so it will actually get 11 pages long. And you can't just put standard deviation function within Tableau because we have to use level of detail calculations, so that's what fixed n is. P average has to be different than average of average. We just are interested in actual average. So those are some of the things that I have written here. And with all that said, I would like to pass this to Josh for our next steps.
Yeah. So when we took this back to our primary care leadership, obviously we'd incorporated all of the feedback that they had given us, so they were pretty excited about some of these changes. And I think you can see through the different phases of the dashboard how somebody may be able to use it at different levels. So within that the first dashboard where we have that P prime chart integrated not only with details within the tooltip so that maybe a physician who wants to understand what the scores are can look at that, but for a director or manager who maybe has 5 minutes to look at it before they're addressing their team, they can just use the color coding on the trend line to understand where it is that they can hone in, ask questions of their team members, and start to dive deeper into what happened so that they can make those improvements. And then looking at the comments dashboard, thinking about individual providers who have seen their scores decline, looking at the individual comments that are tied to the specific scores that rated them lower would help them understand what they can do. So it's a big change for the way that our physicians and our leaders operate. And so it was very exciting to be able to show that with them. And actually in that session, we had those directors problem solving within the moment and asking us to essentially meet one-on-one with their practice managers so they can understand their insights. So now we have to think about the next steps. And so I mentioned earlier on that we were on Tableau desktop. So right now, the way that we distribute this is through those one-on-one conversations with the practice managers, as well as taking screenshots, printing the PDF, the standard tools that are available there. And so we actually need to partner with our IT teams to figure out how it is that we can get servers stood up so that we can share these insights with the primary care service line as a whole and make it an automated process for us rather than a manual one. Next, we've actually received tons of calls from the different service line directors and clinic chiefs asking for a dashboard like this. So kind of the intended goal of starting with primary care worked. Because primary care actually has to interact with all of the different specialties, they were able to promote the dashboard that they had and encourage that usage. So now we're getting calls and we need to figure out a way to expand the dashboard to all service lines across Stanford Health Care. And then lastly, we have a specific patient experience improvement team, which we call deployment, as well as a physician coaching team. And so both of these teams work with our frontline staff, they work with these physicians. And so how can we partner with them so that they're using these insights to focus the interventions that they're implementing going forward? Because we know that there's a time crunch with how we make these interventions, and we want to make sure that the ones that we're implementing actually have an impact. And so these are really the next steps for Stanford Health Care, and we're very excited to have been able to share this work with you. And so just want to thank you all for your time and attention. Our contact information is available here, and then we also have quite a bit of time for questions. And because we are in the business of feedback and surveys, please complete the session survey in the app. Thank you.